In today's video, I am going to explain two interesting hip muscles anatomy. Let me start from this one. This is psoas. Okay, psoas. Let's do a quick review of psoas, anatomy of psoas. Okay, this is far away view. This is where psoas is. This muscle basically originates from lumbar spines. Okay, basically lumbar spines, maybe T12 as well. Okay, basically axial skeleton that originates from spines. Okay, this is origin. Insertion is about here. This is lesser trochanter. And function is hip flexion. This is general function. Okay, hip flexion and lumbar movement. I believe it can do both for flexion and extension. Flexion, extension depends on angle of lumbar spines. Hip flexion, trunk flexion, and trunk extension. This is a quick review of psoas anatomy. What I want to say about psoas for today's video? Interesting thing is this muscle originates from spine and it attaches to femur. All other muscles except today's two muscles, they originate from pelvis and it goes to femur, tibia or fibula. I shall say that again. All the hip muscles except today's two muscles originate from pelvis, then they go to femur, tibia or fibula. Psoas originates from axial skeleton. Then it goes to femur. What about the other muscle? The other muscle is this one. This is piriformis. Piriformis, this is also hip muscle. This originates from sacrum. Sacrum is also axial skeleton. Where is insertion? Insertion is here. This is greater trochanter. That originates from sacrum and it inserts to greater trochanter. Look at that. Sacrum is axial skeleton. Piriformis originates from sacrum. It goes to greater trochanter. Okay, this is psoas. I have to keep repeating. All the hip muscles except psoas and piriformis, they originate from pelvis and they go to femur, tibia or fibula. These two muscles don't originate from pelvis. What can I say? So if these two muscles get tight, of course their tightness affects for hip movement because they attach to femur. They are hip mover. Oh, by the way, main function of piriformis is hip abduction. Abduction and external rotation. Okay, piriformis does abduction and external rotation. So when psoas and piriformis get tight, their tightness of course restricts hip movement. However, simultaneously, there is possibility that tightness affects for axial skeleton directly. Look at that. Piriformis originates from sacrum. Psoas originates from lumbar spines. Their tightness may affect directly for axial skeleton. This is very important thing. So tightness of these two muscles may directly affect for axial skeleton dysfunction. Don't get me wrong. Other hip muscles also affect for lumbar movement, sacral movement, like gluteus medius. Tight gluteus medius restricts pelvic movement. If pelvis doesn't move, sacrum and lumbar spines don't move. But think about it, this is kind of an indirect effect, right? Gluteus medius originates from pelvis. It doesn't attach to sacrum nor lumbar spines. This effect is kind of an indirect. Psoas tightness and piriformis tightness is direct. That directly affects for axial skeleton. Don't get me wrong. Other hip muscles are also important for axial skeleton dysfunction. However, I want you to notice that psoas and piriformis originate from axial skeleton. Knowing this kind of anatomy, kind of a minor anatomy, help for your studying, maybe for your career. I hope today's video helps for your such things. If you liked today's video, please hit the like button, comment and subscribe. See you next video.